Why are statins so controversial? Statins might be the most argued about drug in modern medicine, and honestly, I get why people are confused. There's a lot of noise about them online, and yet doctors still prescribe them to hundreds of millions of people worldwide. And this is actually one of the most common questions I get from patients in clinic. So, what's actually going on? I'm Dr. Jeng, a heart doctor, and let me explain. First, the reason doctors use statins is pretty simple. Huge clinical trial meta-analysis involving hundreds of thousands of patients show that if you lower LDL cholesterol by about 1 millimole per liter, the risk of major cardiovascular events, things like heart attacks and strokes, drops by roughly 20 to 25%. That's a really big effect in medicine. And how do statins actually do that? Your liver makes cholesterol using an enzyme called HMG-CoA reductase. Statins block that enzyme. And when that happens, your liver starts pulling LDL cholesterol out of the bloodstream, which lowers the cholesterol that forms plaques inside arteries. But interestingly, statins do more than just lower cholesterol. They also reduce inflammation and stabilize plaques, making them less likely to rupture, which is what usually causes a heart attack. Now let's talk about the things people worry about. The big one is dementia. A lot of people think statins harm memory, but when researchers actually look at large studies, statins users often have a low risk of dementia and Alzheimer's disease, probably because healthier blood vessels mean better blood flow to the brain. The other common concern is muscle damage. About 5% of patients report muscle aches and something we call myalgia. But through muscle inflammation, myositis happens in roughly 1 in 1,000 patients. Severe muscle breakdown is extremely rare. In fact, a massive 2026 analysis of randomized trials found that 62 of 66 commonly listed statin side effects had no causal evidence at all, meaning many symptoms blamed on statins occur just as often in people taking placebo. So are statins perfect? Absolutely not. Muscle symptoms and a small increase in diabetes risk can occur, but serious complications are rare. And for people at high cardiovascular risk, the benefits dramatically outweighs the harms. So statins aren't magic, but they might be one of the most misunderstood life-saving drugs we have.